pain here in my shoulder, and I have like some pretty bad trigger points here. And I think it's just a mixture of all of this. I know a long time ago I pulled my trap muscle while doing some rope climbs. Over time, like anything I do overhead like this, it's just major pain all in this area. I know a long time ago I pulled my trap muscle while doing some rope climbs.
Yeah.
I worked for a physical therapist at the time, so he was able to kind of like
that's convenient, right?
But I don't have access to that anymore.
How does it hurt? Is it like dull and achy? Is it sharp and stabbing?
So it's dull and achy when I'm just kind of like resting, but if I do anything overhead, I do feel like I'm more like sharp pain.
Starts to become sharp.
Yeah, and it's here that I feel it, and then kind of like in this area.
Okay. Do you get numbness or tingling going down into the arm and hand? Okay. How often are you having that?
It's only when I have like pressure on something, I feel like numbness here, and then I notice in my elbows too. Even just like resting my elbow down, I get kind of a pain.
Okay. And by pressure, you mean like if you're trying to work on a trigger point or something, and then you feel it going down? Okay, gotcha. And only the left shoulder, or?
Left shoulder hurts really badly. I feel the elbow situation is with both arms, but I don't really have any pain on this side.
Gotcha.
Overall though, my entire body is just stiff.
Stiff and tight, okay.
Because I haven't really taken care of myself.
Yeah. What we're gonna do is we're just gonna see if we can figure out exactly what's going on with the shoulder, what's causing it. Could be the ribs, could be the musculature, could be the shoulder joint itself. So we'll take a look and see if we can figure out what's what, and then we'll go through and get you adjusted and try and help you out, okay?
Okay, cool. Awesome.
Okay, so let's just see how well you're moving to start with. So let's have you sit up nice and tall for me. Bring your chin down to your chest as far as you can. Okay, and then look back to the ceiling as far as you can. Okay, come back to the center. Look over your left shoulder and your right. Okay, and then let's have you stand right here for me, face towards the door. Reach down, touch your toes as far as you can. Okay, and then come on back up, bend backwards as far as you can. Okay, yeah, a little stiff coming back there too.
Yeah.
I noticed you said you have some hip flexor stiffness.
Yeah, so I was doing some front squats once, and I had my toes turned out, and when I went down, I pulled something here, and it took months to recover, and ever since then, it's just like...
Felt strange.
Yeah.
Okay. And a little bit of just kind of dull low back pain occasionally?
Yeah.
First thing is, let's just have you take that left shoulder overhead far as you can, and then the right. Okay. And now what we're going to do is we're going to come out just like this, and then go overhead far as we can, and come back down, and we'll roll in. Okay, so we got pretty good external rotation, but I can see you're a little limited coming in there. So let me take a look at how the shoulders feel. Okay, decent movement. A little bit of clicking there.
Oh, there's a lot.
Yeah, this one's a little bit more restricted, for sure. And we can obviously adjust your shoulder, so.
I've noticed, and this is a new thing, that I feel like kind of like a tightness here where it needs to pop.
In the front of your chest?
Yeah, like right here where my sternum is.
Like stiffness?
Mm-hmm. And sometimes I'll move and it kind of cracks a little, but it's just not enough.
Yeah, never quite what it feels like it needs. Okay, let's have you go face down. Your face will go right there where the paper is, and then there's a little handle for you to put your hands on. Perfect. A little bit lower, right there. Okay. Yeah, okay. Definitely got some stiffness in those ribs. So when the ribs aren't moving super well, like this, then it makes it hard for the shoulder blade to move over the rib cage, and that can cause some issues with the shoulder itself. Yeah, super stiff right here too. Okay, so we're probably gonna start right here. We're gonna go ahead and get you adjusted. Do you have any questions for me before we get started?
No, I don't think so.
Okay, so we're gonna go nice and easy. My hand's gonna go right here. Good, I'm gonna give you a little turn. Good. How's that?
Great.
Okay. You were popping before we even got started.
Mm-hmm.
Good. Okay. My hand's gonna go under your hip here. I'm gonna use that kind of like a handle, and we're gonna go right here. So nice and easy. I'm gonna give you a little twist. Perfect. How'd that feel?
Great.
Good. Do a similar thing on this side. Good. Perfect. Good. And then let that whole shoulder relax. Good. Okay. Good, reach a little deeper. There you go. And now whole arm loose. Deep breath in. Out. Let the shoulder relax. Good. Okay. A little bit there on the ribs, and then we're going to do the mid-back. Breathe in. Out. Good. Loose, loose, loose. Okay. A little tough there. Let's try that again from face down. So do a little bit of arm massage gun here to loosen that up. You can just drop those arms off the top. Perfect. Let's take a big breath in, out, let those shoulders fall. There we go. That was tough from face up. Okay, let's see how we're doing down here. A little bit tight in this hip here. Is that painful at all?
No.
Okay. Okay, so we're going to adjust this hip joint, and we're going to adjust your low back too. So let's have you roll on your side. You'll face me over here. Good. I'll pull you off that shoulder a little bit. Right here. Okay. So deep breath in, out. Give you a little twist. Good. Perfect. How's that?
Great.
Good.
I already feel so much better.
So much better. Good. So if you roll to this side. And then this one's going to be mostly for your low back. So right here, I'm going to bring your hip a little closer. Good. Awesome. And then we're going to go right there. Comfortable?
Yep.
Okay. Breathe in. Good. Perfect. Okay. A little bit right there, huh? Mm-hmm. Neck nice and relaxed. Good. It's going to be fast, but it won't hurt. Okay, let that head fall. Perfect. One more on this side. Good. A little bit. Okay. Pretty tight, huh? Okay, so we're going to go here. I'm going to give you a little pull. Good. Deep breath in. Out. Let it all go. Perfect. Okay. How'd that feel?
Amazing.
All right. So now let's go ahead and have you sit up and face this way. And let's take a look at this shoulder. We're going to do a mobilization here and see if we can get it to move for us. Okay, a little tight. So go ahead and relax everything. One more. Yeah, that one's a tough one. Okay, let's have you put that hand right above your waist. Good. Now relax this elbow. I'm going to pull it towards me. And I want you to pull your elbow backwards. So pull hard, hard, hard. Yeah, perfect. How was that?
Wasn't expecting.
Yeah, a little surprising.
Yeah.
Okay, and then we're going to do the same thing over here. So hand on your waist. Relax that elbow and then pull back. Hard, hard, hard. There we go. Better. Mm-hmm. Okay, so let's do that motion again. So let's go overhead. Good. And then come down here. Good. And then we're going to rotate in. Yeah, that looks a little better on that side now.
It feels better. I still feel a little bit, but it feels much better.
Kind of tightness going into it.
Yeah,
so
it's been pretty this has been a thing for a
Yeah.
while.
Go ahead, lay on your back real quick. I just want to see how all the muscles around that area feel. So we're going to take a look at the chest, okay? Right here. Does that give you any shoulder pain?
No, but I feel numbness.
Okay, into the hand.
Yeah, and then I feel like slight something in the elbow.
A little bit of massage right here. That okay for you? Good. Good. And are you having any numbness here? If I go under the shoulder blade here?
No.
Nothing. Okay. We're going to work on this for a little bit. Let that elbow just totally relax. There you go. So this is a little muscle called the subscapularis, and it can give you all kinds of shoulder issues when it gets really tight. Good. Doing okay? You're a trooper. I know that one's not fun. And then, is this giving you numbness into the arm or anything?
No numbness, but that's where I feel most of my
Pressure
tightness,
and everything?
yeah.
Okay. I'll do a little stretch here. Good. Doing okay? Okay. All right, so let's take a repeat look at some of those movements. So we'll have you stand over here like you had, and let's have you reach down, touch your toes.
You want to face this way?
Yeah. Good. And then come on up, bend backwards. Looks like you're bending a little further.
Yeah.
How's that feel?
Much better.
Better? And let's have you have a seat right here, and we'll go chin down to your chest as far as you can. Yeah, that looks way further. And then look up towards the ceiling. Good. And then over your left shoulder and over your right. Good. And how's that feel compared to before?
Better, yeah.
Good.
Much better.
All right. So what do you think?
I feel much better.
Yeah.
This is just, I don't know. I've tried so many things and couldn't get relief. So,
Yeah. You feel like there's less pain and less of that sensation?
yeah, like it feels so much better.
Yeah.
It's cracking a little still, but.
Yeah.
And they all said nothing was wrong with my knee, and
Seems like something's wrong with your knee.
I have really bad knee problems. It stops me from walking across campus too far. I'll start to have knee pain. There's limitation to my workouts. I can't do squats if it's not on the Smith machine, just to catch me in case my knee gives out on me. And I can't do lunges with too heavy, like too much weight on the sides, because my knee will give out on me. I feel like it just sets me back. When I get older, I feel like it's only getting worse. It's definitely not getting better. So I just don't want to have like future problems with my knee.
Okay, was there ever a mechanism of injury, like a trauma?
I have been a cheerleader and I ran track, so I think it was just like wear and tear. It just progressed over time.
Seems like something's wrong with your knee. It's
Yeah,
hurting,
I mean-
right? And what have you tried?
I wear a knee wrap. I ice my knee. It's definitely discouraging, to say the least.
You like working out a lot, yes?
Love working out.
How do you have to change your workout because of the knees?
I have to go lighter in weight. I stay away from squatting. I stay away from deadlifting. I stay away from hip thrusts. I don't want to completely cut those exercises off. Those are the best ones. I'll just have random knee pains. Even when I'm sleeping, I'll wake up in pain over my knee. I can't go on long runs.
And this is both of your knees.
Yes, I think I could say that my right is worth.
Have you ever received chiropractic care before?
I have not. I've never been to a chiropractor.
Okay. Are you nervous or anything like that?
Definitely nervous, but I have a lot of hope in you.
Okay. All right, good. What in particular are you nervous about?
I can go paralyzed for all I know.
Right.
It's just like fear.
Something catastrophic.
Yes.
We're going to do a full examination and check you out and give you appropriate treatments. So hopefully you're not going to have any catastrophic things happen with you today.
I'm really excited to get this started, and I want to crack my knee right now.
Okay. All right. Well, let's get started. Okay. So I'm going to start by feeling around with the muscles of your neck and just seeing how you're doing. We're going to go all the way head down to toe as we work towards your knees, okay?
Sounds good.
And I'm going to start just by feeling for tension in the muscles. So you can calm down.
Okay. Yeah, I'm like super tense right now.
Yeah. It's okay. And it's normal too. And so this is a myofascial release technique. So what I'm doing is I'm feeling what muscles are tighter than other muscles that could be impacting the movement of your neck. She did say that she's got some stiffness and some discomfort in both her neck and her lower back. So we're going to be addressing that on the way down to treating her knees.
This feels good.
Yeah, releasing. So with a myofascial release, as I'm feeling for which muscles have the tension, I'm actually releasing it as well. And that's why she's noticing that it's feeling pretty good. A lot of tension in those muscles, huh? And now what I start doing is feeling for the movement in the joints. And whenever you have restrictions in the capsule of the joint, that impacts how you move and control your body. So I want to know, can you tell this? When we go to this side, your neck moves really nicely, and there's even some bounce at the end. It's great. When we go right over here,
Yeah, that felt good.
yeah, that's why there was that release. But I would actually like to do a neck adjustment to that segment right there. It'll do.
They do? Okay,
Yeah.
don't tell me that.
All right, so we're going to go right over here, and then there's going to be a little thrust, okay?
Ooh,
Yeah.
that felt good.
And now you feel that bounciness return.
Yeah.
That's cleaning up that joint and the movement in there. Good. And there's a little bit right there. Do you feel that?
Yeah.
You ready?
Yeah.
Good.
Yeah.
Just a little guy. All right. All right. So now I'm just feeling around here. Plenty of stiffness right there. Oof. You feel what I'm talking about?
Yeah, definitely.
Okay, so I'm going to give a little thrust over here as well. Good. A little bit right there. Breathe out. Good. All right, I'm going to see how your hips are moving. A little stiff right there. Not too bad. Try to relax.
Okay.
I'll tell you when I'm going to do something, okay?
Okay.
All right. I actually do want to mobilize your hip down a little bit like that as I go into external rotation, because I'm not really liking your hip's ability to move. And since we're about to be dealing with your knees, how your hip moves has a huge impact on how your knee feels. All right, muscle test. I'm going to push down like that. Don't let me. Go.
Ooh.
And again, ready, go. Not so good. Pushing there, ready, go. A lot stronger, right?
Yeah.
Okay, so what we're going to do is do an adjustment to the segment where the nerves that come out of there actually control the hamstring. So it's indicating your hamstring being weak is indicating that, hey, there might be something going around here going on in your lower part of your spine. So I want you to turn on your side, this side up, facing me. So this is your first little back adjustment, huh?
Yeah. Can you tell?
You just seem nervous.
I am nervous, but it feels really good. Like I haven't been in pain yet.
Yeah?
Yet.
That's where the nerves come out that control that hamstring. So what I'm going to do is bring you over here. Okay. And there will be a little thrust, okay?
Okay.
Deep breath. Good.
Ooh, that felt good.
Very good.
I needed that.
Yeah?
Yeah.
Go face down. Let's see what it did. Muscle test. Pushing there. Don't let me go.
Wow.
Way stronger, yeah?
I'm impressed.
Good.
It's
All right.
magic.
Bring your knee up.
This knee?
No,
Which knee? This
just
knee?
like that. I'm going to push it down into the table. Don't let me do that. Go. Not good. No. Again?
Okay, no.
This guy? Pushing down. Let's do both of those again. Pushing down. Okay? And this guy, down a little bit more. Pushing down.
No, that needs super weak.
Super weak, huh? Good. Deep breath. Breathe on out. Good. Face down. So notice there wasn't that big release, big crack. And let's test here. Raise up. Pushing down. Don't let me go. But it was way stronger.
Yeah.
So the crack is not the indicating factor that, hey, this was a successful maneuver. This was not a successful maneuver. So I'm feeling for how your hips move. I don't like this. Your right hip is a little stiff into external rotation. Okay? If your hip can't move well, it puts abnormal torque on your knee. So that's probably a contributing factor to what's going on here. So I'm going to do a quick little adjustment where basically I take your hip and then I'll do a little yank like that, okay? Try to relax.
I'm trying.
All right. Good. Good. And you'll notice already it externally rotates a little bit better.
Yeah.
So what tested weak there was the rectus femoris, okay, which is one of your hip flexor muscles. And most of the innervation comes out of right there. So we're going to do a little manipulation, okay? Breathe out. Deep breath. Breathe on out. Good. Lay on your back. Pulling out like that. Don't let me. Ready? Go. And it was already better, wasn't it?
Wow.
So hold on to the table. I'm going to yank you here like that.
Okay.
Don't let me, okay? And then relax your foot. Good. Let it go.
Sorry, I'm focusing on too much.
Yeah, it's okay. Good. So still a little bit weak, really, towards your posterior, tibialis posterior muscle over here in your foot, which does attach up to the calf, so it impacts the knee. Try your best to relax.
Okay.
Right. Which is not easy, huh?
No, I'm really ticklish.
Oh, that's what's happening right now?
Yeah.
I'm tickling you? Good. All right. And that's a little bit weak. Same sort of thing. Foot turned in. I'm going to spin it out. Don't let me go.
Ooh.
That's just a little bit weak.
Okay.
So we'll do a quick little knee adjustment. Right there. And now we'll do that same muscle test. Spin it out. Don't let me. Ready? Go. And that was a little stronger, wasn't it?
A lot stronger.
Same deal over here. Good. Let that go. Good. I'm going to spin your foot out. Don't let me go. Much stronger. Now, I'm going to actually check out the meniscus within the knee and see if there's any fixation or restriction. Right there, it's moving just fine. Let it go here. So it's pretty good there. We'll check another spot of the meniscus. It's almost like it goes too far. You feel how far it's spinning?
Yeah.
There's a certain amount that your shin bone, the tibia, should be able to spin or rotate on your knee. Yours is going too far.
So I need more shin bone.
You need more stability in your knee to limit the inappropriate motion. Good. Does that make sense?
Yeah, I get what you're saying.
Too much motion.
Is that common?
Common.
Okay, that means no.
Well, sure, it's common. That doesn't mean it's okay.
Yeah.
Lots of people have knee pain, you know? So I obviously, what I was saying was the rotation of the knee is excessive and not helping her meniscus. And I really do think that's what this issue is. This is a meniscus
Yeah,
problem.
I think so too. I used to say I tore my meniscus,
Yeah.
but it never came up.
Sure. And so what we want to do is make sure her hip moves as well as possible so that it minimizes extra forces, rotational forces on her knee. Now we're going to start our progressive rehabilitation. We went through the chiropractic treatment and we found plenty of imbalances, right, in how she was moving her body, and we got a lot of things firing, so that's good. There's this little window for about 30 to 60 minutes where her body is moving really, really well. So now we want to do the progressive rehabilitation.
I didn't think it was going to be hard at first. I'm like, okay, I always like this is easy work for me, and then it ended up being harder than what I expected. Definitely a lot harder.
Yeah. Could you feel the difference in the stability from one hip to the other?
Yes, for sure.
Okay, so pop your pelvis up. Good. And now what I want you to do is go forward with your pelvis. The second exercise, the side plank. What was that like for you?
Deadly. Literally broke out a sweat. I struggled with that.
What'd you think?
I feel like $1 million.
Yeah?
Like seriously, I feel a lot better. I can't wait to like go and work out.
But you have some stuff to work on right now.
Yes, I do. I'm going to go home and work on my exercises.
So what would it be like for you to actually have stability and control in your hip?
I feel like it would be life-changing for sure because I'd be able to do everything I can't do. And that's the reason for it all.
Yeah.
After all, I'm glad we figured it out.
What does your life look like going forward with healthy knees?
I feel like I'll become stronger just in general. I'll be more toned, everything that I'm like trying to shoot for, I'll be able to do. Not just like lifestyle, activeness, all of it.
Yeah.
I'll be able to go on walks and not struggle. I'll be able to do the weight that everyone else does.
So coming into this experience, you were pretty nervous. What was your experience and how do you feel about it now that you're on this side of it?
It literally didn't hurt at all. I was even asking people, like asking my friends, like, hey, have you guys ever been to a chiropractor? How bad does it hurt? And like even some of them were like, it depends, like the hips hurt, blah, 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 saying like different things. So even when you were like, well, I'm going to rotate your hip, I was like, oh God, this is the part where I'm going to scream. It did not hurt. Like on a scale of pain-wise, 1 to 10, it was like literally a 2.
Okay.
Didn't hurt. It was more of like a relief feeling. Like I literally feel like I lost weight from all the air bubbles being out of
pressure
me. Yeah.
going down in your system.
And then I recently went to boot camp and trained for the Air National Guard. And then I got back, and as personnel, it's a desk job, and then I was just sitting. And so I've been trying to do a lot of HIIT training, but with sitting a lot for like 9 hours a day and then only doing like 1 hour of exercise, I think it's really thrown my body and my back off. It was very rewarding, both physically and mentally. I was in really good shape, and my job is as personnel, so whenever I got back, I was going through all of this movement and exercising and moving constantly and burning lots of calories, and I was in really good shape. But I think once I started cheerleading back in the 7th grade, it's kind of came and gone.
That's really when it started.
Yeah, it's kind of always bothered me, like my lower back, and honestly my shoulders too, just from lifting a lot over my head. But it's kind of recently made its comeback and appearance, and I'm like, why are you coming back?
A little bit.
It's curved.
Not such a straight. So we would call it scoliosis.
I have scoliosis.
You have scoliosis. But you have very small amount of scoliosis. Probably about 30% of the population has scoliosis. Your right hip is about 7 millimeters lower than your left hip.
Okay.
So you're walking around, I mean, just imagine one tire's a little flatter, one tire's a little fuller if you were a car.
I'm doing this a lot throughout the day, where I'm trying to like get it to balance. And when you know in the Wii, when you step on it and it like kind of tells you which one's more, it's always heavier on one side.
Yeah.
So.
Okay, so we reviewed Kaylin's medical history as well as her x-rays. We saw some imbalances in her pelvis as well as her thoracic spine with a little bit of scoliosis. The neck curvature was down a little bit, so we're going to want to look at all that stuff. We did a movement assessment, and we noticed pain and discomfort when she was going into flexion, aka bending her, touching her toes, leaning back, bothered her back, and then rotating her whole body to the right caused some stiffness limitation. I think those are some contributing factors that we want to look at. Turn your head to the right as far as you can, and now all the way to the left. looked to me like going to the right was just a little bit limited. Would you agree with that? Or
Yes.
yeah, okay. Any discomfort when you're doing that?
No, it just kind of stops.
Together all the way, bend over, touch your toes. Good. Any pain, stiffness, discomfort in the low back?
Lower back, yeah.
Yeah? Okay, come on up. Put your hands over your head.
Like this?
Lean back as far as you can. What did that feel like?
Like pinches a little bit in my
In
lower
the-
back.
Okay. Turn and face to that wall, feet together all the way. Rotate to your right as far as you can until you're looking at the camera, actually.
Okay.
Good, and now the left. Looked to me like it was a lot easier to go to the left than the
Yeah,
right.
I think my right is very limited.
Did you feel discomfort in the low back during the right? What do you feel right there?
No, it's kind of like, it doesn't hurt. It's like it can't go.
And squat as low as you can. Maybe a little, yeah, there you go. Is that as low as you can go? And up. And up. Any discomfort with that?
No.
All right, so I'm going to go right here, and I am going to do a little thrust into that segment because there's a limitation in the joint, and we want to get rid of that. Okay? All right, ready? Good.
Oh.
So that was your first adjustment.
Yeah.
You okay?
It was great, yeah.
It was good? All right. Your hair's not pulling too much, is it?
No, it's fine.
Good. We got a few there, huh?
Yeah.
So we got rid of any restriction in the neck. Now what I'm going to do is a series of muscle tests, and that tells me what's doing well, what's not doing so well in your body, okay? I'm going to push down.
Okay.
Don't let me do that. Very good. Any discomfort? Put your thumb and your pinky together. I'm going to pull them apart.
Okay.
Don't let me do that. Ah, ready? Not so great, huh?
Okay.
All right, so the nerves that control those muscles come out of your neck right around here. So what I'm going to do is an adjustment right there,
Okay.
and that helps to press a reset button. Good. Thumb and pinky together, pulling apart. Much stronger, huh?
Yeah.
And that's what chiropractic is. Okay, finding dysfunctional areas or imbalances and restoring them. And the suddenness and the quickness stimulates the nerves in a way where it presses reset. Upper neck, right around there. So we're going to adjust that. Very good. Thumb and pinky. And it's stronger, but it's still a
Yeah.
little weak, isn't it?
Yeah.
So let me see what I can do. Sometimes that indicates something off with some of your wrist or carpal bones. Okay, thumb pinky, pulling apart. Still a little weak. So now I'm feeling for your wrist bones to see, are they all moving the way they should? Any discomfort right there? So we're going to do a mid-back adjustment. So kind of like I did with your neck right at the beginning, I'm going to feel for any restrictions or limitations in your back. And right there, I definitely feel it. And you feel it too, yeah? So what's going to happen is you're going to put your chin to your chest, kind of like a sit-up. Good. I'm going to grab you here, and then I'll give you a little thrust, okay? Deep breath. Breathe out. Good. All right, muscle test. Pushing down.
Okay.
Don't let me do that.
Okay.
Ah! Come on, other side. Pushing down. You see that difference?
Yeah.
Okay. All right. So your hip flexor just tested weak. The nerves that control the hip flexor come out of your spine right around there. So what I'm going to do is, well, that. Okay? A little bit more. Ready?
Yeah.
Very good.
Yeah.
Pushing down. Don't let me. There you go.
Wow, it's like magic.
Yeah, right? Muscle test. I'm going to push down and out. Don't let me.
Oh, okay.
Good. Down and out. Don't let me. Okay. All right. Breathe out. Good.
That was a good one.
Yeah. Muscle test, pushing down and out. Way better, yeah?
That is way better. Yeah.
Good. All right, muscle test. I'm going to push down like so. Don't let me do that. Really good. Pushing down. Don't let me. Really strong. Raise your knee up. I'm going to push your knee into the table. Don't let me do that. Really strong. Knee into the table. And that's not as strong. You can tell, yeah?
Yeah.
So the glutes tested weak, Kaylin. All right, and the sacrum right here. Remember we said the sacrum was rotated?
Yes.
The nerves that come out of the sacrum are what control that. So we're going to go press a reset button on that.
Reset the glutes.
That's right. Deep breath. Breathe out. Good. Hold it right there. I'm pushing down. You see the difference there?
Yeah.
That is rock solid, right? So hug your hands to your, yeah.
Okay.
And what you're going to do is you're going to raise your butt up off the floor.
Okay.
And then I'm going to bully you around.
Okay.
There's two possible outcomes. Number one, you've got good control and stability. It looks like this. Number two, you don't. It'll look like that.
Okay.
Raise your butt up. Not exactly great, right? All right, relax for a second.
I thought I was going to do better.
So let's try something.
Okay.
Put your knee to your chest. I'm going to push your knee from out to in, and I want you to resist that.
Okay.
Good. Just resist it like that, and now raise your butt up off the floor, and I'm going to push. It's not great. Okay,
Okay.
down. Your right fist, put it up in the air towards the ceiling, and now raise your butt up. Still a little bit off when I go that way. Did you feel more stable when we were doing the fist thing or when I was pushing on your knee?
The fist thing.
And raise your butt up off the floor and down. What's happening here is the kettlebell is stabilizing your body.
Okay.
You're right, it's a core stabilizer. And then you're restoring proper movement to your hip without low back motion that might cause harm.
That one feels a lot stronger.
Exactly. That's your imbalance. So
Okay.
it's like when you were twisting to the one side
Yeah.
and it was fine and you twisted to the other side, it wasn't. Because this is actually an anti-rotational exercise. When you raise your butt up, your body wants to fall to this side, right? So you're learning how to not let it. You're going to shift your weight towards your heels and stick your butt back till you tap the wall and then stand up straight. And then if you do it successfully, you get a 1/4 inch away from the wall. And eventually, you really have to shift those hips way back, which is what hinging at the hips is.
So like this.
Yeah.
And then move up.
Yep.
And then move up. Okay.
Yeah.
Move up.
It's Kaylin, and I'm doing a 24-hour post-treatment follow-up video. This morning, whenever I woke up, I felt like I could move around more. I wasn't as stiff, and I think that had a lot to do with the chiropractic treatment with Dr. Hoare yesterday. Overall, my experience was a 10 out of 10. I thought I was going to go in there for like 20 minutes, and he was just going to pop me here, but the overall experience, like they did x-rays, and then I had scoliosis. I didn't even know I had scoliosis, and I didn't know my hips were uneven, and he was very thorough and educating throughout the whole process, and I'm very excited to continue treatment with Dr. Hoare and hopefully take preventative measures with my body, since I am going to be very physical, hopefully, for a very long time. So thank you again, Dr. Hoare, for helping to grow out, and I really appreciate it.
My neck, and from then I just could never figure out what was wrong with it. I have some lower back pain as well, but it's on the opposite side as my neck pain.
Okay.
So I don't know if there's a reason for that opposing force. So
Okay. All right, so we've got neck, we've got
A
glute,
little
we've got
zigzag.
hamstring. All right.
Yeah.
If you had to pick which one to get rid of completely, which one would you pick?
probably the neck pain.
Touch your chin all the way down to your chest. Any stiffness or discomfort with that?
Yes.
Where?
It's through the back of my neck.
Okay. Look back as far as you can. Any discomfort there?
Same. Just
Same
the
place?
center more.
Okay. Keep your body neutral. Turn your head to the left as far as you can. Any discomfort there?
Through the right side.
And all the way on the right. And that's pretty stiff and limited.
Yeah.
So that
that's
same
the
discomfort?
Same spot.
All right, can you face the wall here? With your right arm, reach down the middle of your back as far as you can. Good, now the other side. Very good, now reach below as high. Any discomfort with those arm movements?
The one with my right arm behind my back, yeah.
Any discomfort there?
Just in that right hamstring.
The hammy. So put your hands over your head, lean back as far as you can. And what do you feel right there?
Not really anything.
Okay, face directly, feet together all the way. Twist to your right as far as you can until you're looking. Twist your hips and everything. Good. And now the left. Good. Any stiffness, discomfort?
To the right, it felt like it wasn't as loose to twist.
Okay. Feet about shoulder width apart. A little bit wider. Put your hands over your head. Squat as low as you can. Good. And coming up. Pain, stiffness, discomfort, anything?
No.
Okay. All right. So show me that one of the sit-ups or one of the poses that where you can really tell that your neck is bothering you.
Probably. It kind of starts from here and it goes into, say I'm doing a full body sit-up. It's this first motion.
Okay.
So trying to keep my feet planted and coming up till about right there is where I feel it.
And you felt it just now?
Yeah, on that right side.
We'll flip around and show us a couple of push-ups.
So it's only if I'm doing like a wide bicep push-up.
Okay.
And it's on the descent and going back up.
And you feel it in that neck area?
Yeah, and that one kind of spans like down the shoulder.
Okay. Okay, so we went over Sierra's x-ray as well as her old examination forms. We did a little bit of a movement assessment and we saw there was definitely some limitation and strain with her neck movements, with her shoulder movements, and even some irritation and limitation with some of her rotational movements. So we're gonna go over all that sort of stuff and see what we can do to help her today. Okay, so I definitely feel some restrictions in your neck. I'd like to do a neck adjustment, okay? Are you comfortable with that?
Yes.
All right, okay. All right, you ready?
Mm-hmm.
Good. Okay. You ready over here?
Yes.
Good. All right, so some muscle tests. You ready?
Okay.
So make a fist. What I'm going to do is push your elbow down, good, and resist just like that. But just stand your ground. You don't have to. You don't have to win.
Yeah.
Okay. Pushing down. Again. Not so good.
No.
Okay. Any discomfort there?
No.
All right. So that was the coracobrachialis muscle. All right. And the nerves that control that come out of your neck right here. So even though we already did a couple of neck adjustments, we want to get right on that segment and stimulate it, okay? Okay. Let that go. Okay. Make a fist, pushing down. A bit stronger, yeah?
Yeah.
Good. Now put your thumb and your pinky together. What I'm going to do is pull them apart. Don't let me do that. Come on. Not so great. Right there. Good. Thumb, pinky. Pulling apart. Not so great. Okay, relax. So sometimes when we don't get those muscles firing, indicates a little bit of an issue with the wrist or your fingers. Put your thumb and pinky together like this. Pulling apart. A little bit better, yeah?
Yeah.
Don't let me do that. Very strong. Great. Okay, make a fist. I'm going to push down. Don't let me. Go. Awesome. Hold it right there. I'm pushing out like that. Don't let me. Pushing that way. Don't let me. Really good. Relax. Make a fist. I'm going to push down. Don't let me. Pretty good. No irritation?
A little bit.
It was irritation.
Labrum area.
Yeah. Okay. Good. So what I'm going to do then is do a little adjustment. Because that's the coracobrachialis muscle, like I said. And so I'm going to adjust your AC joint. So let that go right here. Make a fist. Pushing down. Good. Same irritation?
No.
Good. All right, thumb and pinky. Pulling apart. Don't let me. Not so good.
No.
Okay. And yeah, definitely a little bit of stuff there. Good. Thumb, pinky. Pulling apart. Better, yeah?
Yes.
I'm going to pull that way with your elbow.
Okay.
Don't let me do that. Again. Not good, huh?
No.
All right, so my thumb goes in your armpit. I'm going to wrap my hand around your shoulder blade.
Okay.
And get all up in your grill here. We're going to adjust the rib cage underneath your shoulder blade. So I'm going to grab your elbow, you're going to relax it, and the adjustment's going to be down like that.
Okay.
Take a deep breath. Breathe out. Very good. That's funny. So relax. Right. What I'm going to do is adjust where your clavicle meets your sternum right here, so we can see if we could turn on these pec muscles that weren't firing. Good. Hold it right there. Pushing that way. Stronger, yeah?
Yeah.
Pushing that way. Very good. Okay. A couple other ones. Straighten your hand. I'm pulling towards me. Don't let me. Not great, right?
Yeah.
Did it hurt?
A little bit in that, kind of more to the back of the shoulder.
And what it's looking for is this bicipital tendon as it starts in the shoulder and goes down. Sometimes it gets a little stuck outside of its groove. So what I'm doing is putting it back in its groove, and I know it's very tender, right?
Yes.
Good. Straighten your hand, pulling towards me, don't let me. Again, did nothing. Okay. And it hurt pretty good too, still, right? Okay. Tell you what, straighten your hand. I'm going to push towards you, don't let me. Good. Okay. Pushing down.
Oh.
Yeah, pretty
that
painful.
one hurt really bad.
Okay, so I'm going to do an adjustment right here with the shoulder. So try to relax. Good. Hold it right there. Pushing down. Still not pretty good. Okay. Put your chin to your chest. Breathe out. Good. And a little bit more. Good. Hold it right there. Pushing down. A little bit better, yeah?
Yeah.
And I'm going to pull towards me. Don't let me.
Yeah.
Now that's firing. Good. We got that going. I'm going to do some muscle tests. I'm going to push down like so. Don't let me do that.
Okay.
Ready? Again. Pretty strong. Good. Pushing down. Don't let me. Ah. Not so good.
Yeah.
That hurt at all?
A little bit. I had a pop kind of in there.
All right. So your hip flexor tested weak. Your hip flexor is the nerve roots that come out of right there is what supports that. So I'm going to bring you over here, see if we can't press reset on it. And you are bendy, huh? Breathe out. Very good. Pushing down. Don't let me.
Oh, that's so better.
A little better, huh?
Yeah.
All right. Keep your legs together. I'm going to pull this leg towards me. Don't let me do that. Ready? Again. Not great. Go. Again. A little stronger.
Mm-hmm.
Not significantly, though. I want to check some other stuff. Pushing down and in. Again. Not great. Down and in. Again. Not great. Down. Don't let me. Ready? Again. Not so great. Pushing down. Don't let me. Really strong. All right, breathe out. Good. Oh no, it was the other one. Pushing down. Don't let me. Way better. Yes.
Yes.
Okay. Good. Now, which hamstring?
It's this one.
To exactly where it is.
It's kind of down the side right here, but
Okay.
more like in the back, like dead center.
Okay. All right. So what's going to happen is we're going to do a myofascial release with your glutes, probably your hamstrings. Come back. And again, go. Does this hurt further?
It hurts when I go further.
Where does it hurt in that spot?
It's kind of like there.
Okay, ready, go. Okay. Again. That's as far as you can go, huh?
Yeah.
Because if you go any further, it hurts.
Yeah.
Okay. Relax your second. I'm going to grab your hip flexors back to the start.
Okay.
Okay, start relaxed. Go for it. Good, and back to the start. Again, go. Okay, back to the start. Again, go. Where?
That is so painful.
Just the skin right there?
No, like that muscle.
Yeah. So I'm doing a little bit of what we call active release technique, and I'm feeling for where the tension is in your muscles.
That's what's very sensitive.
And that is
Yeah.
where it is. So I'm going to get in here with 2 thumbs, and I want you to straighten your knee all the way. Bent. And go. Okay, back up. And go. A little bit better, yeah?
Yeah.
Bend your left knee, straighten your arm. Good. Arm down by your side. Keep your teeth together. Touch your chin up to your chest. And down. And again.
I didn't feel anything.
Good, give me 10. That first exercise where we had you laying on your back and you were kind of tucking to your chin, but you're holding the weight in the one side. What was that like for you?
Definitely a lot of strain in the right side at first, but
Okay.
once we kind of switched the hands and did the other side, I could see where it would build strength.
Yeah. So we turned them on first and then had you do that flexion pattern, and suddenly there was way less discomfort. The range was pretty good, and we're able to start helping out. Back like Superman does. Hold it right there and tuck your chin to your chest all the way and back to neutral and down. Good. Does that hurt?
Not really, no.
Good. Switch arms and legs. Tuck your chin to your chest. Good. And back. No pain?
That one pulls a little bit on that right side of the neck.
Okay, good. Exercise, we kind of took it to the next level. So in a quadruped position, you have to control more of your body weight. So it's a little bit more difficult. And we found the right core engagement, and then put your chin to your chest. Moving you to the next level where it's a more functional sort of thing. From here. Okay, I'm going to push from here. I'm going to push from here. Good, now chin to chest. Good, 2 more. Last one. Good, okay, relax. You doing okay?
Yeah.
Okay, so that's our treatment.
Thank you.
Yeah, how did that go overall?
It went well. I definitely think those exercises will help with strengthening my weaker right side.
Yeah.
Yeah.
You know, we were able to address your neck, but I think with your lower back and your hips, and particularly that hamstring, we felt that knot in your the lateral head of your hamstrings. I think there's a little bit more work to do with you. So if you'd like to come back, we could certainly set that up for you. But thank you so much for being such a great patient. You were a great sport today. You can find Sierra at Pure Bar in Knoxville, as well as in
Artistic
Alcoa.
Dance Unlimited.
Artistic Dance Unlimited in Alcoa.
It's mostly the right, but it does go to the left too.
Was there anything that started this whole process?
My first year of college, I really badly strained it to the point where it was on the edge of tearing, and I had to stop for about a month and a half. Must have done a movement and strained it slightly, but thought it was nothing, and then kept going and just doing everything as usual, weights, practice, conditioning, and then it just...
In the last 2 years, as it's kind of gone up and down, what have you tried to have it get better?
I've tried rehab to strengthen. I've tried stretching a little bit more, because I'm very inflexible. It's very frustrating because whenever I start to feel it a little bit, I don't want to push myself because I'm worried that it'll get to that point again. So even when I feel something slight, it frustrates me and I'm scared to keep practicing or keep training.
Well, we're going to make sure we do a full physical exam and get a medical history on you and make sure whatever we decide to do is appropriate and will help your hip going forward, okay?
Thank you.
Well, this should be a great experience for you, and hopefully you get to learn a lot while we're helping you out. So let's get to it. Okay, so we did an examination and reviewed medical history for Alexandra. So we're going to jump in here to the treatment part, and we're going to see what we can do to help out with her hips. And as chiropractors, we always want to start at the spine and then work our way towards the extremity. So I'll start right here with the neck, and I'm just going to feel for your motion. Now, we did notice, Alexandra, a little bit of limitation and discomfort during the exam. Is that correct?
Yeah.
All right. And you've noticed lately increasing stiffness in the neck, huh? Mm-hmm. Okay. So what I'm going to do is just palpate some of the muscles in the area, and I'm looking for specific spots. I'm going to pull your hair here a little bit, where we can hopefully help and reduce some of the muscular strain in your neck. A little bit of tension in there, right?
Mm-hmm. I can feel it.
Yeah. That was my elbow. So that segment right there is a little bit limited. Can you feel that it's limited or stiff in there? It hurt?
Yeah, when you press on it.
Well, so it was my fingers pressing that hurt, or was it the movement itself?
Your finger pressing on it.
Got it, okay. A little bit of a release there. All right, so you certainly have a little bit of muscular tension in your neck. What I'm going to look at right now is the restriction. So we go right over here. You feel the difference? Mm-hmm. It's not as good, right? No. So let's address that. So I would like to do a neck adjustment on your neck. All right? I know you're uneasy about that. Are you okay with me adjusting you?
Yeah.
Okay. Now what we do with an adjustment is it's just like cracking your knuckles. I'm going to bring you to the end range here, and then I will do a little thrust, okay? You seem very uncomfortable.
I'll be okay.
It'll be fine, okay? So, right there.
Hi.
Good. How you doing?
Oof.
Are you okay?
Yeah.
So we'll go right back over here to just feel. Does that feel different to you?
Yeah, it feels less stiff.
Good. There is a little bit over here as well. Are you comfortable with me going on this side?
Yeah.
Okay. Okay, you ready?
Mm-hmm.
Good. Okay. And the scary neck part is over. Good. So now I'm just going to go back to a little bit of muscle motion. There's not going to be any sudden thrusts or anything like that, okay? Still a little bit of tension, actually. Right over there. You feel that?
Yeah.
I'm going to do a couple of muscle tests here to see what's going on down there so we can see how we can improve it, okay? Mm-hmm. So make a fist. I'm going to do a muscle test where I push down into the table. Mm-hmm. Don't let me do that. Ready? Mm-hmm. Go. Good. No problem. Your thumb and your pinky. Mm-hmm. I'm going to pull them apart. Mm-hmm. Don't let me. Ready? Go. It's just a little bit weak. Okay. Relax. All right, I know I told you I wouldn't do any neck adjustments, that we're all done, but I think I lied, okay?
Okay.
I would like to adjust down here. Now down here is your C7, T1, okay? And these nerves right here are part of what controls that weak muscle test that we just did. Okay, so I'd like to adjust down here, all right? Let it drop. Good. And now we'll check back over here, thumb and pinky, pulling them apart. Don't let me. Ready? Go. That's where I'm going to pull your elbow in this fashion. Don't let me, okay? Ready? Go. That's pretty good. All right, I like that. Your head, we'll put it over here. I'm going to push your head and your shoulder away from each other. Don't let me do that. Ready? Go. Good. And I'm going to do the same thing on the other side. Ready? Go. Great. No problems. And breathe out. Good. There we go. You okay? You sure?
Yeah.
You don't look like you're having a blast so far. Any irritation there?
No.
Now, where are you feeling the pain when you feel it?
It starts here and it goes all the way down.
It shoots, does it go all the way to the knee?
No, like it normally stops around there.
Comfort when you did that. Push in there, don't let me. Ready, go. A lot stronger on this side.
Yeah.
So that's one of these imbalances that we're looking to correct. Okay, so turn on your side, face this direction. All right, so what I'm going to do now, the muscle that just tested weak was your rectus femoris, which is one of your hip flexor muscles. Now, that muscle, the nerve that supplies it, comes mainly out of right here. So we're going to do an adjustment to that segment right there. Good. All right, lay on your back. I'll do a muscle test of that same area. Straighten that guy. I'm going to push down. Don't let me. Ready? Go. We'll do some other muscle tests. I'm going to push down and out like that. Don't let me. With this other hand, I'll just be stabilizing your leg. Ready? Go. And that was pretty weak, and then you had a nice pop. Uh-huh. Does it pop like that a lot, or no?
Sometimes.
Okay.
Yeah.
Okay. Pushing down and out. Don't let me. Ready? Go. Good. Let me see your arms. All right. Face towards me. And that adductor muscle that just tested weak mainly comes out of L3. Yep. Good. Lay on your back. I'm going to push down and out. Don't let me do that. Ready? Go. Good. So both are firing nicely, even though that caused some irritation to have that little pop right there. So that's good news. We're going to push down and in. Don't let me do that.
Oh, sorry.
Resist right there. Ready? Go. Great. Down and out. Down and in. Don't let me. Ready? Go. Very good. Toes up. I'm going to pull down like that. Don't let me. Again. Okay. Down. Don't let me. All right. Good. Can you flip around on your belly?
It's stiff.
Yeah.
Both sides. This one less than the other.
Yeah. Agreed. Okay, so I'm going to do a little manipulation into external rotation here, okay? One more here. Good. And that hurt. It was pretty uncomfortable, yeah?
Yeah.
Okay. A little bit easier now, though, with that motion, so that's good. A couple more muscle tests. Going to push down. Don't let me. Ready? Go. Again. Good. I'm going to do a little bit there. Good. Go face down. And raise your knee up. I'm going to push down into the table. Don't let me. Go. Good. This guy, bend here, raise up. Pushing down into the table. Don't let me. Lovely. Flip around on your back. You got some flat feet, huh?
Yeah.
How'd you get this?
I walked into something. You know those, like, when you park your car, they're right in front of the car?
Uh-huh.
Yeah, I walked into one of those.
Okay. So you've got flat feet. They're also kind of stiff. I'm going to do some muscle tests with the feet too, okay? So this foot is up and in. Hold it like that. What I'm going to do is push from this direction. Don't let me. Go. That's great. Point and in. Good. I'm going to push from this direction. Don't let me. Go. Great. Point and out. I'm going to push from this direction. Don't let me. Go. Good. Up and out. Hold it right there. Push from right here. Don't let me. Good. Nice and strong. That's great. Up and out. I'm going to push from right here. Don't let me. Good. Point and out. Push from right there. Don't let me. Good. Point and in. Push from right here. Don't let me. Great. Up and in. And push from right there. Don't let me. Very good. Okay, so all your muscles are firing pretty nicely. Now we just want to see if we can loosen up your foot a little bit to provide a little bit more shock absorption when you walk. Man, that is stiff right there. Right in the middle of your, yeah, right in the middle of your arch. And it hurts?
Yeah.
All right, so I'm going to do an adjustment where I kind of yank on your foot. Could you hold on to the table so your body doesn't slide? Good. Good. Now we'll go back over to the arch. A little bit better motion there. One more yank over here. That's good. See, this arch moves just a little bit easier, doesn't it?
I still feel it though.
Yeah. All right, I'm going to do a yank from over here. Good. So with this left foot, your heel likes to invert fine. Eversion, do you feel how much it just doesn't like that?
Yeah.
And on this side, it inverts great, but there's some nice give to your eversion. So I want to improve that over here. Because any restrictions or fixation in the joints of your foot can lead to compensation in other areas. Okay. So what I'm going to do is going to look a lot scarier than it's going to feel. All right. I'm going to evert your ankle, and then I'm going to do that. One more here. All right. And now there's a little bit of motion. It's not wonderful, but it's better. Good, and we got one more here. Hold on. Great. I was doing myofascial releases on your hips, both to your hip flexors in the front and then some of your glutes and external rotators in the back. What did that feel like for you?
That was painful because I felt like every point that you were pressing was tender when I was making the movements.
Yeah, we got some serious tension, huh? So this is a myofascial release. So anywhere where over time the muscles have too much stress and too much tension, that alters how you move and control your hips and pelvis. So by releasing them, it will help to normalize the forces on your hip, but that doesn't mean it feels good to get that done. No. Last one. Good. Down towards the floor more. Yeah. Good. Come on back. And I'm feeling like the tension is down there. So that's what I want to release. What's under my hands right now are the tissues I'm actually putting attention on them, which helps to release them. So keep going, keep going, keep going. This is called hip flexion, this motion. Keep going. And obviously it's not great, right? It feels painful and stiff. So during the progressive rehabilitation, we're going to give you some exercises to start retraining this. Alexandra, what was that like?
It was different.
You look like you hated it.
No, I didn't hate it. I didn't love it.
What were your not favorite parts?
The neck.
The neck adjustment, right
the
at the
neck.
beginning.
Yeah.
That's not an uncommon experience. There's plenty of people that love that stuff. There's plenty of people that hate that stuff. And then there's plenty of people that are uninterested in actually getting this kind of care because of the fear and concern about those adjustments. How do you feel right now as a result of the treatment?
I feel very relaxed,
Yeah.
especially more in this area. Because I think that I had a lot of strain there that I didn't know I really had. That's been released
No, I'm embarrassed to say it's probably been like 10 years. It's kind of chronic. Some days are better than others. It really does affect me. So I would say probably something that's gotten a little bit worse over time.
So we did look at her x-ray and we did a full examination on her. And one of the things we noticed was a little bit of a trouble spot, some degeneration in the lower part of her neck. Did anything happen 10 years ago?
I was in a lot of sports.
And she had a little bit of restriction in her shoulder, which I think is a contributing factor. Like what sports?
I was a power lifter.
Okay.
I was a cheerleader. Anything extreme.
That's another tight spot too, huh?
That's like the big one, like that here.
Uh-huh.
I don't have to tell you, obviously you just found that.
What sort of activities do you notice get affected?
Sometimes I know a little bit of weakness if I look up or just really lifting up the left shoulder, which is huge in what I do as a ballroom dancer.
Sure.
At this point, I basically try to avoid anything overusing the left shoulder. By overcompensating using other muscles or other sides of my body, sometimes the pain will switch. So at this point, I would just like to kind of get to the root of it and figure out what I can do.
What have you tried so far?
I've tried stretching, strengthening my back muscles, meditation, breath therapy. I've tried another chiropractor.
What was that process like for you?
And maybe there's a little bit of fear factor in that, but
Do you have a fear factor right now?
a little bit.
Okay.
Now I do the waltz. I chose a much more relaxed way of life.
So your hip flexors are a little bit weak on the one side, and the nerve that controls that comes out right here.
Okay.
All right. So what I'm going to do is manipulate it. Give me your arm. You okay?
Yeah.
Good. Lay on your back.
Shag hurts so good.
There you go.
Thanks, Dr. Hoare.
Anytime. So what we're going to do is I'm going to do the examination on you, figure out what's going on with your neck and your shoulders, and then we'll do the chiropractic treatment first. Okay. So I'm going to adjust that segment right here.
Okay.
All right. And you're a little nervous, right?
I'm nervous, yeah, because it's just tight in general.
Your hair's a little caught up.
Here, there you go.
That's good. Fine. Right there. Can you feel what I'm talking about?
Yes.
That little... Okay. No? Good.
Oh, that was easier than I thought.
And look how much better it moves.
Yeah.
That's good.
That was a lot easier than I thought. This side I'm a little more nervous.
Yeah. All right, drop. Good.
That was better than I thought too.
Yeah. Oh, that went nice and smoothly. Do a little traction here. I'm going to tilt your head over here. I'm going to push your head here and push your shoulder there, kind of away from each other.
Okay.
So don't let me do that, okay?
Okay.
Ready, go. Here and here, same deal. Ready, go. And that's stronger, isn't it?
Yes.
So we're going to adjust a little bit lower on your neck, right over there. And we're not expecting the big pops and cracks like we just got.
Okay.
Because we already adjusted. Good. All right. Hold it right there. I'm going to push here and here. Don't let me. Ready? Go. I'll do some muscle tests. Make a fist. Pushing down. Don't let me go. The muscle they just tested weak is called the coracobrachialis, and it attaches right here at the AC joint. So we'll go in right here and give a little. Make a fist. Pushing down. Don't let me go. So that nerve is the C8T1 nerve that we were testing. So I'm going to adjust this area right here. Good. I'm going to stick my thumb right in your armpit, wrap my hand around your shoulder blade.
There we go.
Okay, just that. Right there's good. Put your left hand on your ear. Good. And good. And I'm going to thrust down there like that, okay?
Okay.
Deep breath. Breathe on it. Good.
Oh, that was great. What was that? That was great. Okay.
Hold on here. We'll do the muscle test. I'm going to pull out.
It's very strong. Okay.
Ready? Go.
Okay.
What I'm going to do is an adjustment where your sternum and your ribs meet each other. Okay, so I'm going to go right in here, and we'll do an adjustment. And frankly, this one doesn't feel great. Okay. Good. Hold it right there.
Okay.
Pushing out there. Don't let me go. Chin all the way to your chest. Bring your head up like that. That's good. Okay. That was fun, huh?
That was a word for it.
All right, so you see, what I'm doing is I'm doing muscle tests, and that tells me what areas need attention, right?
Okay.
And I am kind of testing the muscle, but I'm caring more importantly about what controls the muscle. And that tells me neurologically, as a chiropractor, what I need to start dealing with. Because we're taking all these imbalances of yours, right? We're looking to reduce them as much as possible, aka get you back to normal. And then we're going to do the progressive rehabilitation, where we create better posture, better movement for you.
Okay, awesome.
Make sense?
Yeah.
We'll do the lower part of your neck right there. Good. One you liked on the other side.
This one's my favorite.
Deep breath. Breathe out.
Okay, just not anymore, actually.
Yeah. All right. A little bit different spot here. So that was painful, huh?
A little bit. I wouldn't say pain.
Breathe out. Okay. Good. Hold it right there. Pushing that way. Don't let me go. Good. Pushing that way.
I like this. Okay.
Pushing that way. Don't let me.
Okay. Good thing I wear stretchy pants.
Yes. Good thing. Okay, good. That opened it up real nice. So that was just a hip socket mobilization. We'll do the same thing over here, because you said this one you could feel some discomfort, right?
Yeah. My husband has a problem with this. I should bring him in here.
Well, most people's hips aren't moving very well. Ooh, yeah, this one's a lot tighter though.
Yeah.
On the other side of there. Okay. Wow. Not bad,
Much
huh?
better, yes.
All right, good. Pushing down and out. Don't let me. Go.
Okay.
Towards me, that's perfect. Scooch it just a little bit. Good. Good. Lay on your back.
See my face.
Pushing down and in. Don't let me. Ready? Go. Yes. And let it go, breathe. Good. Okay, lay on your back. We'll do a quick little, your right ankle is a little bit stiff. You know that?
Sometimes, I mean, it's not something that like actively bothers me, but.
Okay. I'm gonna give it a quick little yank here.
Oh.
Good.
Okay, that's a first for me, I think.
Okay. Actually, I want to check something though. So you're not. See, like I don't feel a lot of tension or stiffness, a little band in there, but
Sometimes, like, I don't know now, I do feel a lot better than when I walked in here.
just kind of pop out. So we're gonna make sure it's not. One more here. Good. Yeah. Amanda, what was that like?
It was great. I was a little bit nervous in the beginning, and then after we went through some of the adjustments,
He didn't even tell me he had a 15 before he threw a 20 or 25 on me.
That's correct.
I mean, I felt immediately better after each different thing that you did, and exercises that we did afterwards, I feel like that would really help me. Never had anybody show me that way. It was effective, but it was simple, so I thought it was going to be a little bit more complex.
Well, we're not very complex around here. I'm gonna put my fist between your knees.
Okay.
Try to break my fist. Good. Keep. That's one of the cool things about the system we use for the treatment is instant feedback on did this work or not. Pressing reset buttons throughout your body. And then through the progressive rehabilitation, you're actually learning how to change how you move so that you're not 10 years from now still saying, oh, I've had this neck shoulder thing for about 20 years.
Right.
You know. So if you no longer had to deal with this neck and shoulder thing, what would that look like in your life?
It really kind of gave me a dull, chronic frustration, so I think it would just give me a little bit of levity to my life, probably. We all try to be professional, and I try to give everything that I can. I don't know if they know that there's a brighter version. I'm really looking forward to seeing these exercises that I won't have such a discomfort after the movement and lesson.
Sure.
So, and I definitely think, knowing going into that, feeling more confident and just getting strength in the shoulder, I definitely think that I'll feel better about it. If I feel better about it, they're going to appreciate.
You have really good range of motion. You do not have the stability and strength that you probably did have in the past.
Right.
And that's the sort of thing we can address. We can stabilize your shoulder so that maybe it's not perfect, but we restore confidence, comfort, strength, stability to the area That's really what we're looking to do. Do the exercises before you're active, whether it's a workout or a lesson, or if you know you're going to play with your kids and you're going to be holding them or whatever it
Always,
is.
yes.
It's like it's movement prep. Because after you do the exercises, you are now a little bit stronger, a little bit more. And come on up. Good. Lunge on one side and then lunge on the other side. Perfect. Good. Okay. Feel how your neck is moving and feel for any restriction in there, and that'll kind of tell me what we need to do. You got a little bit of restriction right there. Could you feel what I'm talking about?
A little bit.
A little bit? All right. So I'm going to go right over here. And that spot right there, it's a little bit restricted. So I want to get some motion in there, okay?
Okay.
You ready? You sure? All right. Drop right there.
Oh.
Good. You all right?
Yes.
All right, good. Now we'll go on the other side. Okay. Good. All right, and you got a little bit over here on the other side as well. So let that go. Very good. All right, you okay?
Yes.
You seeing straight and everything?
Yeah.
All right, not too bad, right? All right, good. So the neck part's over, so the scary part's over for you. For me? Good. Deep breath. Breathe out. You all right? Breathe out. You feeling okay?
Yes.
You're not hurting?
No.
All right, good. All right, I'm going to do some muscle tests of your lower body here. I'm going to push down like that. Don't let me do that.
Okay.
Ready, go. All right, okay. Breathe out. Good. Okay, let's have you go face down now. You doing okay?
Yes.
You're moving slow. All right, I'm gonna do this muscle test again. Pushing right here, don't let me. Go. Hold it right there. I'm gonna push your leg down into the table. Don't let me do that. Go. Awesome. Other side. Up here. Pushing down, don't let me. Very good. Okay, on the right side, I'm going to adjust your L2 segment to see if we can't get that a little bit better. Okay. Good. Okay. You having a good time here? All right, breathe out. Do that again. Breathe out.
Oh.
Good. All right, lay on your back. Breathe.
Oh.
Good. Lay on your back. You all right?
Yeah.
That one hurt a little bit, huh? I'm gonna grab your hip flexors like this, and when I say so, starting position.
Okay.
All right, so I'm gonna grab your psoas muscle right here, and now straighten your top leg and bring it back towards me. Good. And again. And there's plenty of tension in there, isn't there? Okay. Again. And again, now we're going with the iliacus muscle. Just as painful?
A little more.
And again. So it's a little tender, huh? Okay. Good. Just one more here. Good. Okay. and now I'll do some stuff on my own. Now we're on the TFL, tensor fascia lata, which is another hip flexor muscle, which she'll tell you, plenty tight, isn't it? When we have certain areas of our body that don't have the stability and control that they need, it really overtaxes the muscles in the area. So the muscles start becoming tight, stiff, tender, that sort of thing, because the actual core stability of the joint in there is inadequate. Good? Now I'll grab the back of your hip. When I say so, I want you to lock out your leg, kick forward and towards the floor as far as you can. So I'm grabbing the piriformis muscle, some of the external rotators, our glutes, and again, we've got some tension, especially right in the posterior capsule of her hip, and that's what is making her feel a little tender at the moment. Again, good. All right, kick forward all the way, hold it right there. Good. It's a little tight, isn't it?
Oh, so my Achilles are just like really bad right now.
I was gonna say,
it's been really terrible.
Okay.
Both of them.
Well, I'm glad that that came up.
I forgot.
So that we can address that. All right, I'm going to do some muscle tests. Bring your foot up and out. Hold it right there. I'm going to push from this direction. Don't let me. Good. Now I want you to point your toe and go out. Good. I'm going to push from right here. Don't let me. That's great. Now point and in. Hold it right there. I'm going to push from over here. Don't let me. Good. And up and in. Hold it from there. Pushing from right here. Don't let me. Some segments here. Oh, can you hold on to the table? Make sure you don't slide. Good.
Oh.
Yeah. Get some noise out of those, huh? Okay. Up and in. Hold it right there. I'm pushing from over here. Don't let me. Great. Point. Okay. Table. Hold on to it. Good. Okay. Point and in. Pushing from here. Don't let me. Seems to me like the left one is a little bit tighter. Is that what you're noticing? Or are they both?
Honestly, I haven't been paying much attention. But right now it feels like, come down more?
Yeah.
Right now it feels like the left one, yeah.
Yeah. Go get her face. Face or something. Tight, huh? So I'm feeling for the tension not only in the Achilles, but also in some of the deeper muscles. The flexor digitorum, the flexor hallucis longus are both muscles that are deep to the plantar fascia and the calf, but they're an important part of the tension in the Achilles. So we're looking at a lot of stuff here. Good. Okay, so that's the treatment today. So we did the chiropractic first, then we did the progressive rehabilitation. First thing I want to ask is, Nina, how are you feeling?
Much better.
Okay. Are you feeling anything different in your hips?
A little looser.
A little looser? Okay. Good. And what did you think of the exercises we gave you afterwards?
I think the adjustments definitely help. I think it's nice to have somebody who knows what's going on tell me like what is appropriate to do and what's not appropriate to do, like as I'm healing. Because I was pretty much scared to do anything at all. So you telling me like this is okay, this is not okay, I don't know, just really helped me get back in the gym, which was
good.
What I needed.
So now you're back in the gym, right? And Are you limited? Like, what exercises are you avoiding or not doing, or are you doing everything? How is it in the gym right now?
So now I'm doing everything.
So we're back to doing squats. We're back to doing lunges. We're back to getting those gains back that you were losing, and you're not feeling restricted or limited while you're CrossFitting.
No.
Very good. All right.
And because I push with my left, like my back always is like painful on the left. And then because I pull with my right, I also feel like the right shoulder is not great. So it's just like always there's something in my body.
Give me an example of why it's one-sided.
Like for example, if you're pulling with your right arm, pushing with your left, like that's my strong like arm, pulling arm. And I just will keep doing that if it's for a performance, right? Because I would just want to repeat the same move.
Yes.
But then it will be out of balance because I'm not using the other arm.
If that's the case, let's check your range of motion. So I want you to bring your chin to your chest and go all the way back. Okay, look straight. I want you to turn your head the other way. Okay, do you notice it's easier to go that way than that way?
A little bit, yeah.
Right? Okay, now go to the side. Slowly, slowly. Yeah, so you're definitely more restricted going to the right. Okay, how about shoulders go all the way up for me? Go higher, all the way up. Okay, anything there, go down. And then how about to the side, go all the way up. Okay, and then can you do this? Can you touch the other way? One at a time, yeah. Okay, and then how about going behind?
Here feels tight, like when I do this.
Okay, how about on the right side? Can you go like that? And then the other way. Switch. Okay, your range of motion is pretty good in the shoulder. But let's check the tightness of the muscles here. Your traps are pretty tight.
Neck sometimes too.
Neck is a little stiff up there. We're checking mid-back. Yeah, you know, everything on your right side is tighter. You have trouble in that way, this way. Traps are tight, so your right side is stronger. Your right arm is more dominant. Body never lies. And let's check lower back. Lower back feels okay. Wow, your muscles, your erector muscles are very defined here, right there. You feel that?
I feel the bones.
No, we're not. This isn't bone.
Oh.
We're on the side. Your bone is right here in the middle,
okay.
right there. Right, we're on the sides here. There, you feel that?
Yep.
Let's get started. So I'm gonna have you do a lot of motions and movement. So starting off, we're gonna open up your traps here. Bam. Oh, you feel that?
Here, I feel like it doesn't keep going.
Yeah. Do you work out like your traps? Like, do you do like shrugs or something?
Yeah.
Body never lies. Wait, how?
Because you're constantly in like a pull-up position.
Oh, okay. You have like very strong traps. Like I rarely ever feel traps that feel like this. This is incredibly stiff.
Stiff.
Yeah, like feels like cement. I'm not even joking.
That's so good to hear.
Oh, wow. Wow. That barely did anything. I need to bring out the hammer. Actually, we might have to bring out the hammer. Do you feel that? What does that feel like?
It's like something is stuck in there.
Yeah.
Yeah, like a knot. Oh.
Is that tolerable?
Tolerable, yeah. Not comfortable.
Yeah, one more. One more right there.
Here is not bad. I feel like it's like a little bit more. Yeah, here is really painful.
Oh, that actually worked. Yeah, way better. I'm gonna have you go like this, here, and then behind your back, like so. Go. Oh man, I'm about to break my thumbs. And up, and down, and up. Very good.
What is that?
What is what?
Do you hear the clack?
I do. It could be scar tissue.
Ow.
This side's worse, huh?
Yeah.
Yeah.
It's hard to go like all the way down, I feel like.
Do you just hang on a bar at all, ever?
Yeah.
How long can you hang for?
Not long, like 15, 20 seconds.
Okay, we gotta get that higher.
Okay.
Get you up to a minute of hanging. All right, now let's do some adjustments. You're gonna put your hands behind your neck, interlock them. I'm gonna come back behind you, and then I'm gonna lean back, okay? So I'm gonna come like this. Elbows in, head up, and then just fall back for me.
Oh my god.
I'm gonna come up here, okay? Just relax.
I feel like the head is the scary part.
Really? You get it done though, right?
Yeah.
There. Are you good? I got it right there. Drop your left.
Ow!
Why do you say ow?
It's just unexpected.
There it is. That's better. Yeah, and then let it go. I got it. How you doing?
Good. This is the first.
It's a first? Okay, you ready? You're gonna feel a nice little stretch. Okay.
Oh,
How's that?
interesting.
Should feel like a good stretch, yeah? Breathe for me. Excellent. How you doing?
Good.
What does it feel like to you?
This side seems tighter.
On the right, huh? Everything on your right. Do you feel a stretch though when I bring you down?
I feel like the muscle there is really tight.
The left side?
Both sides.
Both sides? Yeah, here, right? Back, like that. Back and forth like that. Okay. Go. So we're getting into your glute medius, her hip stabilizers. Very tight. Imagine from doing all the pull work, requires these hips to lock in. And so this will probably feel maybe pretty tender, I imagine. Not gonna fall. Nice. Oh, wow. It's like lengthening in real time. Has anyone done this to you?
No.
Well, this is your psoas muscle. Say hi to your psoas. Very important muscle for your hip flexors. Very, very important.
Hip flexor always tight.
How is that?
Good. I always focus only on like this part, but not like the entire thing.
Was that intense? Like it hurt so good.
5 to 6.
Yeah. Good.
I've done that one before, but usually it doesn't pop.
What?
Yeah.
Okay, so same thing here. You're going to kick your leg
Back.
back and forth, okay? Scoot back a little bit towards me, because I'm going to support you like that. Go.
Oh. I had like a hamstring injury on the right, and then after that lasted like 2 years. After that, I feel like my right leg is just always
It's never been the same?
Yeah.
What was the injury?
Just I was doing a pole move and I think I overstretched. Like it went out of the split went out of my range.
All right, here we go. So we're on your scalenes here. It's tight on everybody.
Okay.
But for you, it's probably more dancing related than life related. Although it can be both. I am feeling both actually. It might take a lot longer to get better, whereas we do all the soft tissue work. So ideally, they're coming in as needed for maintenance only. They're maintaining on their own.
Ow.
Now we're in the suboccipital muscles here. This all should feel like relieving. My favorite muscle, SCM.
Oh.
adjustment. I got it.
Ah. What is that?
It's a thing that goes over and we pull your head.
Yeah. Does my neck get longer?
You'll get taller, yeah. A little
Let's
bit.
do it.
Let's do it. So what I want you to do is your yoga breathing that you were doing this whole time. Yes. How does that feel on your face there? Is that okay?
Good. Mm-hmm.
Okay, good. And I want you to relax your tailbone, okay? And I want you to tell me when you're breathing, you feel it in your tailbone, okay? So go ahead. One more time. Good. A little pull right here. Wow, your forearms are really tight.
Yeah. I just always want to take them out and then I can squeeze them.
Oh, we should do the shockwave on you.
I've done that one too.
You've done shockwave? Do you like it?
Yeah, it's intense. Oh, this finger is a little injured.
Which
The
one?
small one.
Oh, what happened?
I don't know what happened. But like last week I couldn't bend it. So maybe just leave that one out.
You want me to work on it?
No. No, I think I my finger was stuck behind me, like my body and the pole, and then I just like squeezed it too much. And it was swollen for a week.
Just doing a joint finger massage just really helps, like getting into the joints here. It's a little swollen.
Yeah.
First, I want to do your elbow, wrist.
Yeah, this wrist is a little.
Okay, and your lats, right in here. Okay, let's check your range of motion.
Okay.
Yeah, and then go back. Oh. Oh.
Better, but still a little tight on this
Yes.
side, I think.
Yeah, definitely. I still see it, but definitely a lot better. Yeah, your neck still very tight in there. In there. So yeah, for someone like you, you'd have to come back a few more times, handful more times, and do the same thing. Loosen all this up. Your traps feel way looser, way better. All right, we forgot to check your shoulder range of motion. How is it?
Good.
How's everything today?
Good.
Was
Great.
it too painful? Was it?
No.
I'm also a DJ. I drive a Wrangler. I like to drive on the sidewalks and stuff. I have a cute toy poodle.
It's a dating app. Why you get it?
These are the things that are important to me. You need to know these things about me. I work out occasionally, but I look like I work out a lot. But I work out occasionally, and this is why I'm coming here.
You was getting it in for a minute, though.
I was. But what had happened was I went and got this hairstyle, and I couldn't sweat. And then I got another one. This one I could sweat in, but by the time I got this, I didn't want to work out. So we're going to do a couple sit-ups at home. We're going to, I do daytime fasting. Does that count?
Doing something healthy is good. You know, some people do nothing healthy.
I stretch.
Okay.
But, I tried with this, trying to get it. Normally I know how to stretch and, get my spots, and I just could not get this myself. I was like, yeah, no, I got to call in. You got to call in the enforcers.
How's it feel now? Did that help at all?
Good, yeah.
All right. So a stretch I want you to do for your neck is you're going to put one arm behind your back like this. And you're going to lean to the side, and you're going to hold it. Do you feel a stretch in there?
I do. I feel it all through here.
So hold that while we wipe down your neck.
Okay.
You're getting your hair
it's
done.
so tight.
You're getting your hair done, so we ain't got to worry about the CBD.
Yeah, I'm about to get my hair done again today.
All right, so what I want you to do is just pull it over. No, pull it over.
Oh, like this.
Not so much, though. I want you to take that thing out of socket, man.
Facts. You know, I had to carry all my DJ equipment. I think that's part of it, too.
You got to get an assistant, man.
I know. I got bruises all on my legs. I'm just messed up.
Any one of you guys want to be an assistant?
I pay well.
She pays well. I mean, recording videos and all kind of stuff. You can't go nowhere. All right, just relax.
Okay.
Just relax. Let the arms drop.
Sorry.
Right now?
Yes. Oh, my God.
It's been a while since you've been adjusted, right?
I know, yes. It's been like a month at least. Oh, my.
All right, cool. Just relax on me.
Okay.
Let your head drop. Let it drop just a little bit. Let it drop.
Oh, wow. Yeah. Okay.
See what happened when you take a long break?
That took too long. I couldn't do it. I tried. I thought I could do it. I'm like, I don't need to go to a chiropractor. I could just stretch.
Too much DJing, man. Not enough chiropractor.
Oh, my.
Just relax. Just relax.
Okay.
Let it drop. Let it drop.
Oh. Wow. I feel it all the way to my jaw.
Yeah.
Oh, my God. Thank you. I really couldn't get that. I couldn't do it myself. Sometimes you gotta ask for help, people. You gotta be willing to ask for help when you need it.
Your back is tight too.
Oh no. Oh my God. Wow. I got a lot of knots in my back.
Yeah,
I be on my foam roller crying.
Yeah?
Yes.
You've been stressing out, man?
I'm stressed. People don't know I'm shutting these. You see, I'm carrying a wide load here.
Yeah, I got the same problem, man.
But I did it to myself.
Just relax. Okay. Let's have you lay on your side. Face me.
I'm hugging myself.
Just relax on me.
Oh, wow.
That was it?
Yeah. Because I've been doing everything possible. I went on YouTube. Everything. I'm like, wait, why can't I get this?
Oh, why you going all the way around? All you gotta do is come in.
Because I don't know.
You try to fight it?
I tried. I want to be able to say I can do it myself sometimes.
Oh, man. Don't worry about it.
Oh.
So one of these
Messing myself up.
So one of these people come be your DJ assistant.
I need an assistant, y'all. Come holler at me.
So when your DM full.
Like you get on gas. Y'all gotta be able to help get my ankles to go. Oh, my God.
Just relax, just relax. So when you got patients who bench a lot of weight like myself, sometimes you gotta do them anterior instead of doing them prone. But we're gonna try to still get some of this up in here, right there.
Yeah.
Right there, yeah. So I know you say you've been foam rolling. You might also want to try to strengthen around that area and work on some mobility in that area too.
That's what I was doing. Like, I did 2 back days and then I took a break.
Mm.
So this is what my body's like upset with me because I was doing so much good and then I stopped.
Let your arms drop.
Oh. How? Thank you. Oh my God.
All right, let me have you lift this right leg up and keep it straight.
Like this?
Yep, as much as you can. Good, and switch. All right. One more time on this one. All right. Problem on this side, right?
It is. I can feel it.
Yeah.
It's super tight.
Yeah. Just relax. Good. Let's have you lift this one up again. All right, we're getting somewhere. All right, let me have you grab your knees. There you go. Lift your butt up, push your butt down. All right, relax. One more time. Come on, come on, come on, come on, come on. All right, relax. One more time. All right, relax. It's too hard for you, man. You sound like you're getting out of shape, man.
I am. I just look, like I said, I look like I'm in shape, but baby, I'm out. Like,
come on now, sit on up. Swing your feet around.
Miami.
You run.
Everything that look like it is, it ain't.
Just relax, just relax.
Oof. So my arms were out too. Everything was out.
Everything.
I've been hustling, y'all. I've been trapping. I need a trap. I need a trap assistant.
You want a trap assistant?
We in the streets, y'all. we outside. Oh, this is my trap?
Yes.
That's the traps we talk about.
Fades in here, try to hit it.
Right, I'm sorry. With no RICO charges. The trap is booming, and I'm talking about these traps.
That's it.
The traps is booming.
All right. Stand on up. How you feel?
I feel great.
Oh, yeah. See, this is the industry she's talking about, guys. She's a background dancer.
Okay, yeah, no.
Brings you in.
Been having some problems with my lower back. Just some pain. I wanted to make sure everything was okay.
Okay. So we took some X-rays of the aorta. We also did some other modalities, muscle stems, some traction. How was that?
Wonderful.
Wonderful.
I want one of those for my house.
She took a good nap, right?
Yes.
What kind of work you do?
I'm a speech pathologist.
Speech pathologist. So if you guys can't speak, like myself, she can help you. Or do you just teach different languages? What is a speech pathologist? What do they do?
I work with children who have difficulties communicating, so I help them to find their voice.
So I'm going to lean you forward a little bit. Any pain?
No.
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 Come on back. Anything?
No.
This way? Any pain?
No.
This way? Any pain?
No.
Okay, cool. Now, have you been adjusted before?
No.
No? Now, she's been to a chiropractor, but she's never been adjusted. She's pretty tight in this neck region. Man, do you stretch at all? No.
Yes.
Another no. I see the lies.
I do. I may not
Yes.
be stretching everything, but I do stretch.
We have to get you to stretch these traps because they are extremely tight. Are they tight up in here?
Yes.
Yeah. Let's have you drop your head for me. Let it drop. There we go. Good. Just relax.
Wow. I wasn't ready for that.
That's what she said.
Oh boy. Okay.
You all right?
I am.
Uncross your legs for me. Just relax. How we doing so far?
Doing great.
Doing great. Let your head drop for me. Just a little bit. Let's let the shoulder drop for me just a little bit. There we go.
Not too bad.
Not too bad. All right. How we feeling?
Feeling great.
Move your head around. How's it feel?
Feels fine.
So in our x-rays, we did see some crepitus. That's for crepitus. We saw some DJD around C5, C6. C4, C5, C6. A little bit of evidence of degeneration building up. You're going to do your shoulder as well. Just relax on it. Good. This mic cut off there. There we go. Just relax them. She also came in with a wrist brace.
Yes.
See this arm? How's that wrist feel now?
It's good.
Let me have you grab my hand, shake it. I'm gonna just pull it up and traction it. Good. Now before, it used to hurt going this way. See how it feel?
That's fine.
Any pain? Now she went to an ortho, they put in a brace. Obviously, they didn't send it to a chiropractor because a lot of cases they don't do that. I think we kill people. But, obviously, instantly healed wrist. Good. So you hug yourself.
Hug myself?
Mm-hmm. Straighten your legs out. Mind taking your shoes off for me? Just relax. I got you. Just relax. I got you. It's like Simon says. When I say it, that's when you do it. If I don't say it, you just relax. Just relax. Bend this leg on the top, straighten leg on the bottom. Good. Just relax. Just relax, okay? Good. Let's have you bring this hip forward for me just a little bit. Straight. There we go. How we doing? On your back. You say you had knee surgery? Yes. Any ankle surgery or anything?
No.
Any ankle pain?
But I wear heels.
Heels bad for your feet now. Heels are bad for your feet. There we go. Now I want you to lift this leg up for me. Keep it straight as high as you can. There we go. And down. Now lift up the other one. And down. We're good on both. Lift it up one more time. Down. Lift this up. This one look a little off. Let's see what we got. Just relax for me. Table's gonna drop down like this 3 times, okay? Ready? 1, 2, 3. Let's have you lift this leg up again. All right, I'll take it. How are we feeling?
Feeling good.
Feeling good?
Wasn't as bad as I thought it was going to be. I was expecting worse. What do you mean you don't know what you don't know?
Don't know what you don't know. Now, these traps are very tight.
Yes.
So what I'm going to do is call gua sha or some grafting on it. We're going to work on breaking up some of that scar tissue in there, okay?
Okay.
You mind moving this hair out of the way for me? Do the other side. So when people have these tight traps, They need to work on stretching them. I'm going to show you some stretches as well. And you definitely need to strengthen your posterior deltoids and rhomboids. So a lot of people nowadays have weak posterior chains. So to combat these tight traps, we're going to work on your middle traps, strengthening those. You got to move, man.
I do speed walking.
What if the zombies come?
You know what? I can't.
What about when the machine starts attacking them? You see how AI is going? You got to get ready for that. You think you're going to speed walk away from the machine?
Oh, gosh. It was suggested to me to either swim or speed walk.
Swimming.
After surgery.
Ride a bike, swim. You could roll. You could do a bunch of things. But walking, not my thing.
That's supposed to be one of the best forms of exercise.
Who said that?
American Heart Association.
Yeah, the same people that be telling stuff to kill everybody. American Heart Association, same thing in America. We lead in heart disease in the world. I wouldn't listen to them, but that's just me. I'm a crazy chiropractor. Would you like to donate $1 to the Children's Hospital? I'm sorry, it's very bad. Yeah. Okay. That's how you stand on up. How you feel?
Feel good. It's good.
It's good.
No doubt. It's been painful.
How many days a week you work out?
Every day.
That's what's up. I was gonna say, I was waiting on that answer.
Every day.
You knew, did you get, are you lying?
No.
Oh.
I did 3 miles. I did 300 abs today.
Wow. You did more than me.
See?
All right, cool. Whatever.
Yeah.
Just relax, just relax. Let your head drop into my hand. There we go. Just like 15 years ago. How we doing?
I'm doing good.
Oh, good. Doing good. Turn. Check it.
That's good. Yeah, I could not do that.
Wow. All right. So if anybody's like, oh, don't do that, they're gonna send you to the hospital. You work at the hospital.
No. we definitely promote going to a chiropractor.
Okay, there we go. There we go. Let it drop for me. There we go.
Good Lord. Yeah, could not do that.
No?
I could not do that before. No, it's much better.
Good.
Feel lighter.
Don't wait so long to get adjusted next time, man.
Sorry.
And she know who I am, too. She cool with my wife. She cool with my wife. She went to fam.
Yeah.
Ain't like she went to Cookman or something.
No, absolutely not. That's how you get married. It's beautiful.
And you ain't coming and get no treatment, though.
No, I don't live down here. Anytime I fly into town, I'm coming.
Live in Louisville,
Yes.
Kentucky.
Yes.
All right, let's get you on your stomach. Just relax. You tight up in here, too.
It hurts so bad.
Jesus Christ. I'm gonna hit you with some grassing on that, okay? Let your arms drop. Just relax on me, just relax.
Oh.
Man. 15 years, a pandemic.
Oh my God.
Just relax on me. Just relax. Okay, good.
Oh Lord.
Oh, that's right. Jesus was a chiropractor, you know that, right?
Oh.
Everybody say carpenter. And I keep telling people, he didn't pull no permits. All he did was heal with his hands. He ain't built no tables. All right. Now let me have you lift this leg up and keep it straight. Keep it straight, keep it straight. All the way up, that's how high you can go. Ooh, down. Other one. Okay. Table gonna drop 3 times like this, okay? 1, 2, 3. Let's have you lift that leg up again. There we go. All right. I'm gonna do some gua sha right here. Let me see, can we get here? Yeah. What's this, man?
Scar?
Yeah.
stabbed when I was 17 for 3 times.
You got stabbed?
Yeah.
Man, you a samurai, so. You OG, triple OG. All right, so we're gonna do some gouache around here. Is this where it's tender at, mainly? No, I don't? So we're gonna make sure we get the rest of it out. So how's the weather in Louisville?
It just stopped being cold.
It just stopped being cold?
What? It was cold the other night, like 60.
6? Wow.
But yeah, it's supposed to be cold so long. Oh my God.
Dang.
So, but it's been very hot. Just started to warm up. It's beautiful. All the beautiful flowers and pollen. Well, allergens. We don't have pollen like that. You can see pollen like that up here.
60 degrees in July?
Yes.
I don't even know how that's possible.
On July 1st, it was like 50s.
Wow.
Yeah.
Because our coach ain't shaking that after last year.
And we came down here. Look down here. We played.
All right. Hold on 1 second. Let me wipe her off. All right, how's that feel now?
It's not even as better as it was in the first time.
Wow.
Not even. Wow.
Get some good results real fast, huh? All right. Let me have you lay on your side, face me. Bend this leg. Hug yourself. All right. Why do I still have this? Just relax for me.
Oh, oh goddamn. Oh my goodness. Oh Lord.
How we doing?
I was not expecting that. That's good though.
Bring this from there we go. Bend this leg from me.
Ginger ale.
That's the CBD cream. Thought I opened something up. Turn your head that way. Just relax. Turn your head that way.
This way?
Yeah, there you go.
God damn it. Oh my God. Oh my God. I can smell better, y'all. I can smell everything.
Sit on up.
Now I can scrub the ground now.
Scrub the ground.
We can knock this spine right on back.
Swing your feet around. There we go.
Too little for this. Ooh.
Coach might pay good. Big bling on that.
Swear to God.
I just gotta be a fucking coach. What I know this is doing. That's about good. All right.
Wow. That's great. Oh yeah. Y'all see that? Oh yeah. Okay.
Okay, put me in the blocks. Is that it? Oh my God, dog. When you hit that pop move right there, that Dion, that was, that was awesome. That was great, thank you.
Now you ready to go? Are you ready to run that 3 miles?
Yeah, I can do another 3 miles. I can knock it out. You can't, but I can.
Please, I could, all right. All right.
That was good.
Y'all used to be athletes. I'm still an athlete.
Yeah. Trying to get
Blackwood. So, Ebony, what do you do?
I am a board certified nurse practitioner and I do facial aesthetics. So I do a lot of anything with rejuvenating the patient's faces, PDO threads, Botox, fillers, any radio frequency treatments to help with acne, acne scars and things along those lines, just to make the patient look, face look nicer, smoother, and rejuvenating. So, I've been doing a lot of different things lately, taking care of patients and also working in the med spa and also moving. So I've just been coming across a lot of pain, around my neck, my mid back, right around the shoulders. And I also kind of sleep sideways, like cramped up. So I don't know. And I've just been feeling like just some tingling and pain and just soreness lately.
So Ebony came before, but she's not the most compliant patient. Last time she came was a while ago, and then I just so happened to adjust her at an event. And then she's like, I'm coming in. That's what I had to do to get her back in.
Yes.
Even though I talk to Ebony all the time. Go figure.
It's the shade for me.
As you see, Ebony has all the cute little gear on, let you guys know where to find her. Where can they find you at, Ebony?
In Boca Raton, Florida.
Boca Raton, Florida. Where at?
Yamato Road, 5601 North Federal Highway, Boca Raton, Florida, 33487. Phone number 561-388-9337. And you can head over to our website. Don't mess up my lace now.
What lace?
My lace wig.
What, the lace wig? I'm sorry.
Don't take my hat off.
No, I'm lying lace.
Oh my God. Oh, that felt so good. Oh my God.
Okay, so where can they find you on Instagram?
So my Instagram is cute looks. Oh yeah.
It's the hat coming, the lace coming. I can't control that though. Man.
Oh shit.
That's the only thing that makes sense. Say it was a carpenter. I didn't hear anything about pulling permits. Only by healing. With his hands.
The best.
Only could be a chiropractor. Slide down.
Okay.
Hug yourself. Just relax. All right. Take your shoes off him. Sometimes they be like, no.
I don't need your followers in the comments. I'll get back to you.
You know how them people are. Just relax. Yeah, they're off. Man. Just relax, just relax. Yeah. Oof.
It's been for weeks. Oh my God.
In Paris. You was in Paris?
A couple of years ago.
Ooh. You all right? Weeks. So what was bothering you mainly?
Like right up in here.
Right up in here. All right, so we're gonna do some shock wave up in there. So this is our shock wave, Ebony. Let me know when I get to an area that's very tender. Anywhere? Anything?
Not yet. Feel good. Whole body.
Right here? All right.
Oh my God. How often do you want me to come?
More often than you do.
No, but during the week it's so hard.
But you be in Paris. Clear the cute looks in Paris. It ain't on 54th Street, second half.
Right.
How we gonna get you here from Paris? What does it take?
I'm just gonna have to like set it up and come early. I want to be the first one.
All right, we got you.
Yeah, my early bird time.
You be up early. All right. That is good. So now we're gonna wipe it down. Then I'm gonna do some grassing on that. Make sure that thing is nice and.
Can I go get on the car today?
You could go get whatever you want, man. But once we done with you, I don't know if you're gonna want one. Unless you already had one scheduled. That's a bad wipe job. Gotta fire the wiper. All right, so here we go. We got chemistry CBD, chemistry botanicals. So we're just gonna get up in there. So we're just trying to break up some of the scar tissue. This old injury. Life, Ebony. Life, car accidents, slip and falls. People get punched in the face. Stress. In chiropractic school, they tell us 3 things cause injuries or illness: thoughts, trauma, and toxins. Trauma could be in multiple forms. Toxins could be in multiple forms. Thoughts are pretty much just all you. Ooh, boy. That thing is rough right now, ain't it? All right.
Now, is this gonna be every time I come on, it's just what's going on?
Ebony, please stop talking during my video. Jesus, the feds in doing a sweep, guys. Jesus Christ. It's every time. See what happened? See what happened when you show love?
Right. You get greedy,
They
like,
get-
I want it back.
Just relax, just relax. There we go. It was out all over, man.
Oh my God. It's about to die.
It's about to die. All right, let's close it out there. All right, Ebony, stand on up. How you feel?
I feel amazing. Thank you so much, Doc. I feel like new.
All right. Guys, find Cute Looks Med Spa. Ebony Blackwood. Celebrity. Celebrity. She sees a celebrity and she deals with celebrity. Me, I got 10 viewers. All 10 of you guys watching, thank you for your viewership.
We the best.
Don't go hunt Ebony down.